A startling revelation has emerged from a recent study, leaving the medical community and diabetes patients alike on high alert. Diabetes, a condition affecting millions worldwide, has been linked to a shocking increase in sudden cardiac death. According to a report published in the European Heart Journal, individuals with type 1 or type 2 diabetes face a significantly heightened risk of sudden cardiac death, a terrifying event where the heart abruptly stops beating. But here's where it gets controversial. The study suggests that diabetes might be the culprit behind this deadly phenomenon. The research team analyzed health data from the entire Danish population in 2010, uncovering a grim reality. Among the over 54,000 deaths that year, nearly 6,900 were attributed to sudden cardiac death. And this is the part most people miss: diabetics were disproportionately affected. The study revealed that people with type 2 diabetes were a staggering 6.5 times more likely to succumb to sudden cardiac arrest, while those with type 1 diabetes faced a 3.7 times higher risk compared to non-diabetics. The risk was most pronounced in younger diabetics, with those under 50 experiencing a 7-fold increase in sudden cardiac death. Dr. Tano Han, an associate professor of experimental cardiology, highlighted the alarming rates of sudden cardiac death in specific age groups. For type 1 diabetics, the 30 to 40-year age group was most vulnerable, while for type 2 diabetics, the risk peaked in the 40 to 50-year age range. This heightened risk for cardiac arrest significantly reduces the life expectancy of diabetics. On average, people with type 1 diabetes can expect to live over 14 years less, while those with type 2 diabetes face a reduction of nearly 8 years. Sudden cardiac death alone accounts for a loss of 3.4 years for type 1 diabetics and 2.7 years for type 2 diabetics. Lead researcher Dr. Tobias Skjelbred offered insights into the potential connection between diabetes and sudden cardiac death. High blood sugar levels and nerve damage associated with diabetes increase the risk of heart disease and irregular heartbeat, which could be the underlying factors. However, Dr. Skjelbred cautioned that the study is observational, meaning it establishes a link but doesn't prove causation. This leaves room for debate and further exploration. But the findings emphasize the critical need for diabetics to manage their cardiovascular risk. Modern diabetes medications, such as SGLT2 inhibitors and GLP-1 drugs, may have played a role in reducing this risk by helping patients control their blood sugar. Additionally, high-risk individuals can consider implants that can restart the heart or restore a regular rhythm in the event of sudden cardiac arrest. Future research could focus on identifying which diabetics would benefit most from these implants or other preventive measures. Smartwatches that detect sudden cardiac arrest and call for help could also be a valuable tool, especially for type 1 diabetics who are more likely to experience unwitnessed cardiac events. This study raises crucial questions about the relationship between diabetes and sudden cardiac death. What strategies can be implemented to protect diabetics from this deadly complication? Are there specific interventions that could significantly reduce the risk? Share your thoughts and join the conversation in the comments below.